I'm John Woodrich. I'm the Chief Operating Officer for the Medical Center. I've been here almost 9 years. And I have probably roughly 40 minutes worth of information to cover. But as we have always said in the past, feel free to ask questions at any time. Raise your hand. If you do have a question, we'll take questions at the end. And also, if you feel more comfortable writing your question down, you should have picked up cards. There should be cards on your table. You can write down any question that you have. And I wanted to start with talking about those just ask questions. So you guys do that in here, but we also do it all throughout the year. You have time or the opportunity to go on and just ask questions online, and we try to answer those on at least a monthly basis to get information back to you. You know, some of the topics are about our strategic plan, the growth, process improvement, changes that are happening and all of that. We do get a number of questions related to nutrition and dining and parking. And I would just like to ask that, because we keep answering some of those same questions as they come up, that you do reach out to those directors. I've spoken with both of those directors, and they would love to hear from you directly. So if you do have questions in regards to parking or NDS, please bring those straight to those individuals, but we'll take all other questions that you may have in relationship to things going on here. So here's what I want to cover today. I want to talk about some of our priorities and targets, share with you our patient experience, talk about what we're doing in recruiting because we're continuing to grow, talk about our construction updates. Our Bryan Physician Network is also growing, and I want to share some information with you about that. I want to talk about a security audit that we had done, and talk about one that we had done 4 years ago as well. Some changes that are happening within Epic. Our IV pumps, we're going to replace all those in the organization. Our community outreach that we talk about almost at every forum to encourage people to still do that. And then a bunch of important items coming up on different dates in the future. So here's our organizational-wide targets, and we annualize our turnover rate. And right now, if we continue at the same pace we have been, we're going to have about a 16% turnover rate. And our target is to take it to 14.6. And then that's still much lower than most other healthcare organizations, but we love the longevity that we have here. It's nice to talk to people that have been here for 30 years and 25, but it seems like we're having more of the environment today that people are okay with working somewhere for 3 years and then going on to move someplace else. We've got to figure out how to still make their experience really good here so that when they get done traveling around the United States, that they think about coming back here. I talked to a new nursing grad that had been out a little bit over a year, and she quit from here, and I said, what's going on? And she said, I wanted to gain a little of experience, and I think I've got it, and now I'm going to go out and I'm going to travel the United States. She's going to go work for a traveling agency. And that's some of the difference, I think, than what we've seen in the past. But we'll continue to work on that, and I'm going to share with you later some of the initiatives that we've undertaken to try to reduce turnover and to have better retention. Our patient satisfaction results is at the 56th percentile, our inpatients at the 6th. And I'm going to share with you in the next slide, we're going to go away from percentile rank, and we're going to go to percent positive, and I'm going to explain to you why we're going to do that in 19. Our behavioral is at the 88th percentile, and we look at emergency room, outpatient surgery, and that, and 2 out of those 4, we're reaching our goal. Our serious preventable harm events, we're at 3 for this year, so, we don't really target to harm 3 people, but we try to reduce it every year. So we have continued to do that, but right now we're kind of setting right at that 3. And I think I shared with you before that our operating margin was going to be a struggle this year, and we had set it at 2.1% as our threshold, because we knew we were going to spend a lot of money up front on Epic, and then we had to train everybody, and we had to duplicate our staff for a couple of months. We brought in all those consultants to get this thing rolling, but we're actually ahead of it. We're at 3.2%, And that's through June. I will tell you the medical center had a good month in July. We still don't have the rest of our entities, so we have to bring Bryan Health and Crete and Merrick and everybody else in on it, but I think July will end up being a good month for us. Something that we had pretty unique, you know, Blue Cross and Blue Shield is one of the largest commercial payers here in Nebraska, but they've been losing business. And you probably heard recently the University of Nebraska is turning over January the 1st to United from, they used to be a Blue Cross member. But this is the first month that less than half of our commercial business was Blue Cross. They've always been 50% or higher. It's actually gone less, so you know they're losing accounts, which makes an impact on our reimbursement. Physician engagement, still very high. That scores at the 93rd percentile. Really proud of our infection rates here. A lot of people refer to these as HACs, they're hospital-acquired conditions. But our healthcare acquired infections, this is through the first 2 quarters. 7 of the 8 were below what they say the benchmark should be for an organization our size, which is really good. You know, the 2 readmission areas that we focus on this year is COPD and pneumonia. And the reason why we chose those 2, or those were the 2 that we were struggling with over the past few years. So we wanted to have a concentrated effort. We just received our first quarter data, so this is only for the first 3 months. We're still above where our threshold we targeted, so the lower number the better. But I do want to share with you, every year we get a report that shows our overall readmission, and that's the one where the government or CMS, Medicare, can charge us a penalty or withhold money from us. And we hit the marks for this last series, so we had no penalty going into the future. That was a really good indicator. And then our EPIC, we set 4 big EPIC goals. One of them was rolling it out on time and not having to delay, which we did. We're within budget. One of the other items that we were monitoring was our accounts receivable. So what's accounts receivable? So that's when we bill somebody and they owe us money, and then we find out what the insurance pays us, and then we try to work it down that they pay us the rest of the money. Sometimes you've got to write that off. But we knew we had the old system, and now we have the new system as we went into Epic. You got to work down those old accounts. You can't transfer them all over. So that is still happening. So that causes our accounts receivable to be high because we've got dollars in this system and dollars in this system. We're working both of them. Our goal is to work the old system down to a certain level, and when we do, then we're just going to turn it over to somebody else to work those accounts instead of having our folks do it. But right now we're higher than we wanted to be, but the trend is starting to turn that's our target, is we want to be at a certain point by December. But we're going to probably have to flip those accounts over to somebody else pretty soon because it's just a lot of information to work at one point in time. So here's those patient experience scores, and I think this will give you an example of why we want to change from going to a percentile rank to a percent positive. I believe the system that CMS has set up is now flawed because once you get everybody to a certain level, the band is so tight. I got to tell you, if 80% of our people say they had a very positive experience, I personally am pretty good with that. So just because somebody else has 82%, does that mean we should be ranked lower? So I'll give you an example. Look at the very first line, inpatient pediatrics. 66.7% people had a positive experience. 2/3 of our people did. But when you compare us to others, it ranks us at the 6th percentile. That doesn't make a whole lot of sense to me. Quite honestly, I don't care what they're doing in New York. I just care what we're doing here locally. And we've got to set a mark that makes us say we're providing good care to our patients. I mean, look at our outpatient rehab pediatrics. 76.5. 3 out of every 4 people gave us really positive remarks, but we rank at the 27th percentile. It's because those bands are way too tight. I personally believe the government's going to do away with that system that they set up. I mean, look at our outpatient rehab adult, 86%. Almost 9 out of every 10 people gave us a positive score, yet we're ranked at the 53rd percentile. So just to let you know, in 2019, we're going to be showing this as positive responses or the percent positive instead of percentile. And I do want to call out our NICU down at the bottom there, and you see our outpatient behavioral has been doing very well. So recruiting update, you know, people always ask the question, what are we doing differently to continue to recruit, because we're growing quite a bit. So we have 271 openings right now. You guys know, have any idea how many people we employ today?
5,000.
Real close, 4,900. So we have definitely grown as an organization. The days to fill, we're trying to make sure that we're moving people along in the process, that when they apply, we get it to the right people. They've got to interview them quick, because we're in a tight market. If we're not responding quick enough, somebody else is going to interview them and get them hired before we do. So we've got to make it quicker. From the time to hire, from the time of the application to the offer being accepted is 18 days. We're still trying to work that even down further. Positions filled, we almost filled 900 positions already this year. Had 1,087 openings, but because 194 are new and 893 were replacements. So that gives you an indication of how much we're growing as we continue to open up new units and do some different services here. So what have we done different than what we've had in the past? I thought this was a great idea, whoever came up with this. They sent out letters to 300 of our previous Bryan RNs that left the organization. And they're basically inviting them back and saying, you know, sometimes people leave and think grass is greener on the other side, and it's not so green. So this is a great opportunity to reach out to people and say, hey, we'd love to have you back here. So another different model of trying to recruit. An open house, we've done a few of these now. This one happens this week. We normally get some pretty good positions filled by doing that. We've upped our referral bonus, so if you can refer somebody to our organization and they get hired in what we call these hot jobs, not that any job right now is hard to fill, because they all are. These are especially hard to fill. You can earn an incentive if these people are hired and stay on for a set period of time. And I think when you came in, you got those little cards, they're referral cards. Write your name on the back of that. Put your department and hand those out to people that you believe would be a good employee in this organization. They've got to fit our culture. Think about it. It's somebody that you would want to work alongside of you and you felt comfortable had your back covered, or that would cover the backs of others that are in this organization. So please take advantage of that. We've got on to doing testimonials on Facebook, Instagram, so we're looking for other social media aspects. You guys are the best ambassadors for this organization. You talk positively about this organization, more people will come here to work. You talk negatively about it, people won't even give it a second thought to apply here. So you're kind of the face of our organization. So how can you help? Use those cards, pass them out, write your names on them, give them to people and tell them what it's like to work here at Bryan. You know, when somebody's new in your department, make them feel welcomed. I mentioned this last time, you know, invite them to lunch, learn about them, build a relationship. When's their birthday? When's their anniversary? Be supportive of that person and create that teamwork environment for them. So I'm going to ask you guys, in the next couple of weeks, you're going to receive a link or an email in relationship to taking a short survey. This isn't our employee engagement survey. This is about asking you two real simple questions. Why do you choose to work at Bryan Health? What do you value most about working at Bryan? Because we're going to use that to help recruit people. We want to know what you guys truly experience and feel is very important to you. That's going to help us to become that employer of choice that people want to work here at Bryan. And we won't hound you on this. We're not going to send you 20 emails. We'll send one out. We may send one other reminder, and that'll be it. But we'd like to get as much response as we can, because it'll help us form our direction as we move forward. So construction updates, hopefully you guys all heard about the Ackley Charitable Foundation gift. It was the largest gift we ever received at Bryan, and this is the best indicator that I can give you about the care you provide. You know, we talk to these families and these groups, but it's all about how they were touched by Bryan. So they talk about the care that was given. So specifically the gentleman, if you call it the husband, the father of these kids, he passed away here, but the experience that he had is what caused these people to give this gift to us. So a huge gift, helps us with the major renovation that we've been talking about for years. It's about redoing our operating rooms. Plus we're going to be doing a lot more, and I'm going to share with you a video here in a little bit. And pay attention to the captions at the bottom because it'll show you where it's touring through the building. So we'll redo the ORs. We're going to have private consultation rooms. So the doctor, when they come out of surgery, they'll call to the volunteer at the desk and ask that family to go into that room. There'll be a back door the doctor comes in so you can have that consultation with the family. Give them an update on what happened in the surgery, and they're not hearing it in the entire waiting room. We're going to move our bronch labs from the 5th floor down to the 2nd floor. When we're done with the project, we're going to have expanded space so we can enlarge our ER again. We're going to exceed 85,000 visits probably this year. We will also do a different wayfinding of people to come up to the waiting area. You're going to see a stairwell go in over on the main entrance to the hospital. So just kind of watch the video and you'll see all the changes that will occur.
Those pre and post recovery rooms, are they all going to have their own bathrooms? Is it going to be a hall bathroom?
I don't know how often, not everyone will have their individual bathroom, but they may have them adjoining to the rooms. I do remember when we were designing that, we actually took out, because we had like 40 bathrooms, so it was crazy. And we ended up skinning that down a little bit. Let me tell you, this project's going to take 40 months to do. It's not an overnight thing by any stretch of the imagination. We're going to start this January, and it'll go for 40 months. Because of the phasings, we got to build out kind of the front part of the hospital. That'll become the new operating rooms. Then we shift further into those and start to do different areas. But it's a 4-phase project as we go through it. I do want to comment on this last item I have on here, the new units opening. Everybody realizes we're picking up more business. So July the 10th, we opened up 8 new rooms on the West Campus on what used to be the minor care area for the ED for boarding patients until we can free up a bed. On August the 14th, last week, we opened up another 9-bed unit on 2 North. October the 2nd, we're going to open up another 11-bed unit here on the West Campus where the simulation center used to be. They're moving to the East Campus. And then we're going to open another 11-bed unit about March, April timeframe on the West Campus as well. Our 5 East area on the East Campus, where Pulmonary's at, we're starting to move departments or part of that department out of there. And we will gut that floor and redo that, and that'll add an additional 17 beds. So you can see we're continuing to grow as an organization. Quite honestly, we could take more people right now if we had the capacity to do it. It's all around space and staffing at this point in time, and we staged these out so that we can hopefully bring our staffing in to meet those needs. I think the last time I met with you, we probably had 9 agency staff members here in the organization. Today, we're up to 54. We just continue to add until we can get our staff hired. I will tell you the last 2 graduating classes that came out of the college was their smallest classes of nurse graduates. The next 2 coming out are going to be their 2 largest classes of graduates. It's just kind of the way it works out in the process. But we hope to get more of those folks hired on as well. And then our Bryan Physician Network, if you're not familiar with this, these are physicians that are no longer in private practice that either we hired. Told President Trump not to call me now. So there's 15 practices and 82 providers now in the Bryan Physician Network. So either these are physicians that decided to get out of private practice and, you know, they kind of get tired of the, if you want to call it the government regs, the insurance regs, they say, I just want to take care of patients. So we've moved them over, or they're hard to fill positions that either we don't commute or bring the people on into our community, or we say you need to be employed because they're a hard to recruit position and no private practice wants to take them on. So that's where we ended up with neonatology. Neurology, we now have 4 neurohospitalists, and I'll share some information with you about that. These are all tier 1 providers, so from an insurance standpoint, these people would be great for you to go to because they're at a tier 1, less out of your pocket. So the new growth, North Point Family Medicine, these 7 providers were in 2 different practices in town. They were employed by CHI. They now have joined the Bryan Physician Network, and we opened that up on 27th and Fletcher in July. Our new child and adolescent psychiatrist has joined us. Dr. Bo Kemper has joined Bryan's Women's Care Physicians, OBGYN. Do you see any resemblance of her to any one of our other physicians? You guys know Corey Friesen, OBGYN? That's his daughter. Well, they're going to be in the same practice together, kind of a unique thing. And then down at the bottom are 2 new neurologists, our neurohospitalists. But we have now, they're branching out a little bit into doing some more outpatient work. We'll have the availability of them doing outpatient as well as their inpatient work here. Social Security audit, about 4 years ago, we asked an independent group to come in here and take a look at our organization about areas that they thought we could be vulnerable or that we needed to beef up our security. And they made a list of recommendations, and we made a lot of those changes. So you may have noticed difference in the lighting in the parking lots. Remember when we put the cameras in and people are on a screen now when they walk in the front of the hospital, they know they're being recorded. We cut down bushes, we trimmed trees up so people can see. We hired a security consultant, we refer to him as here, but Russ Smith that has helped us. We've done some additional training. We've changed policies, a variety of things. But we invited him back again a few months ago. And we asked him to take another look at the facility. A couple of good things is they were surprised of all the things that we had already implemented. But they said we got more work to do, so we asked them to give us a list of things. We got that report back a few weeks ago, and now we're prioritizing it into 4 different areas: access, sensitive areas, training, and general operations. And we have teams of between 5 to 7 people that'll be working on these, and we'll start making changes in the organization. So access. One of the things they recommended is that we have to create as an organization some type of badging system for our visitors after a certain time of the night, so we know who's in this building. So they're going to be working on that, and that they need to go through a clearance before people are just set up to a floor. They talked about our emergency department. So the sensitive areas they identified was our emergency department, our mental health unit, and our OB unit. Some of the things they recommended, like in the emergency department, we need better control of how many people we let back to go see a patient, because they're starting to wander in the hallways and everywhere else. They instituted at other organizations different levels in the emergency department. So when everything's kind of calm and just going okay, it's a level green. If something happens that warrants a tighter security, then everybody knows we've gone to a level yellow alert, and you do it with some type of symbol in the department. And if something really crazy is going on, you go to a red alert. So they gave an example. Let's say you had a fight happen in town or a shooting, and the families decide to come in and visit their loved ones. You know, you probably go to a higher level because you know there's going to be some anxiety happening, which means you bring on more staff, you put down tighter controls, you do lockdowns, all of those types of things. So that's what we're looking at and are going to build. I never thought I would do this and say that we would have to do this as a hospital, but one of the components of this will probably be metal screening. We've got to look at doing something different before an incident happens. You guys all read them. I mean, these things are happening in hospitals now. I don't think we can eliminate it 100%, but there sure is a way that we can be a little bit more proactive. I want to tell you, there's no way you guys could count the doors around this place to get into this building. There's no way you can secure them. It just doesn't work for an organization this size, but we think we can make some good steps. And as we do that, there's going to be a training component to this as well. We want to make sure people are appropriately trained. Then there's general operations, some things they recommended. Certain areas having more panic buttons, so when an event occurs that you get help right away. There's recommendation about some more monitors, some more cameras. So we're going to do all that stuff. I just want people to know that these groups, as they're formed, probably within the next couple of months, they're already meeting. We'll be able to put all the plans together and lay out kind of a timeline as to when things will happen, so that people know what's going on throughout the organization. So we take this really serious. This is for your safety, it's for our patient safety, it's for our visitor safety. And I think there's going to be some language that people will have to use. You know, if we decide that we're in that situation where we want to screen people at a certain time, we have to know the proper language as to why we're doing it. And it's nothing about how somebody looks or if they're wearing a leather coat or whatever. It's just we're doing this because we happen to be at a yellow alert right now, and we've got to make sure we're keeping everybody safe. And that type of situation would involve an officer that's appropriate to do that screening, because in case you find something, you sure don't want staff screening somebody, and then you go, okay, what are you going to do with that? So we want to make sure we set up all those proper protocols as we go forward. So Epic update. Gosh, folks, it didn't seem like it was all that long ago that we did the conversion, but we're going to do what we call the tune-up, and this is the next iteration of Epic. But also it's a number of the items that you folks have recommended to be changed as part of optimization. Not nowhere near all of them, it's just a subset of them that we're going to change at the same time. You know, the Epic users are going to be affected. We believe at this point in time that we will not require in-person training. We think that we can do this through e-learnings and tip sheets. This will happen on November the 3rd. It will require us to have a 2-hour downtime. Again, we'll do that in the middle of the night, and the super users will be available for the affected areas. I want to switch gears a little bit to my chart. You guys, if you have not registered for my chart, please do so. One, you can see your test results right away. You can get proxy for your children. You can send messages to your providers if they're a Bryan provider. You can share records with non-Bryan physicians if you need to go see some specialty that we don't offer. Plus, if you as an employee know how to maneuver through this, when people ask you questions, you're going to be a great resource for them. Really good benefits, you know, patient satisfaction, having that information available. Less phone calls. If you talk more of our patients into getting on this, they can see their own results without having to keep calling and wondering what the results are. So, you know, sign up today. I think we got the box out there where people, you got a little card, you can fill out the information as well, but it also gets you 200 wellness points, right? Let me shift gears to the IV pump replacement, big project. We're going to what we call a smart pump, and we'll interface this with Epic in 2019, and what that means is that you'll have the capabilities that you don't have to reprogram something in that could cause an error. That information can be sent electronically. So as we do this, the goal is to roll out all of these pumps there that week of September 25th, get people accustomed to using them. Then in 2019, we'll do the interface with Epic. So you'll be required to complete a CBL if you manage these IV pumps. We'll have super users who could assist their peers. And we'll keep people updated as we go into the future with this conversion. So I talked before about this outreach. We continue to encourage people to do this. If you have an organization or a group that you feel is worthy of receiving some donation between $100 to $1,000, you fill out this through the community outreach button and a committee reviews it. This is where we're able to give back to our community. I go back to our 90th anniversary when we celebrated that and we did these acts of kindness. This is what this is. I think it's a great way to give back. If you guys really think about it, our community is supporting us quite a bit. They're doing it with their feet and coming here to this facility. They're using Bryan as their choice for healthcare. So a bunch of dates coming up here in the future I want to remind people of. Open enrollment will be coming soon for your medical and dental coverage and all that. You will need to fill it out, so you can't just say, I want the same thing I had last year. You will have to go in and put that information in. You know, we think this is important stuff. This is big decisions when people decide what plan they're on. So you'll get a mailing at your home. You'll also get some emails, but we want to make sure people get the information they need to make the right choices. We don't take it lightly to just send something to somebody's home. We want to make sure it's of value. So it gives you time to sit down with your spouse or significant other to go over that type of information. We are going to offer a couple different things this year. Some people have asked about having a high deductible health plan. So besides the plans we have right now, we're going to be offering a high deductible plan. If you're a relatively healthy individual and you don't think anything else is going to go on, and you want a high deductible plan and pay a lower premium, there's going to be that option for you. People have also asked about a health savings account. We're going to offer that as well, and there'll be more information. And this is just feedback that we hear from you guys, either through the employee engagement survey of other mechanisms, so we're trying to offer those programs to you. And then just from the wellness perspective, so the screening starts on September the 5th. And then just as another reminder, if you're still working on your points for this year, the deadline is September the 30th. And that's, again, to qualify for the $480. And if you have any questions, you can talk to Brian or Nikki in relationship to the wellness incentives. Sunday, October 21st is the Capital City Classic, and there's a 1 mile run for the kids, and if you want to do the 5K run or walk, you can choose between that or the 15K, and as an employee, you get a $5 discount off of the registration. And then the Tribute to Trauma Champions is September the 13th. How many of you have attended one of those ever? Quite a number of people. I tell you, if you get the opportunity to do it, you got to take advantage of it. I want to show you a little clip of the individual that's going to get recognized. And this is really people that have beat the odds, that based on whatever accident they were in, they had a low chance of survival, and this individual is quite the story.
The first thing that hit my crew was we had never seen a debris field like we did at this incident.
I was dodging car parts, tires, transmissions.
The passenger door was actually deformed from what appeared to be him exiting the vehicle through the passenger door.
You know, I could see him breathing and just kind of a blank stare.
He's almost face down on his right shoulder, and he's leaking blood everywhere. He's got a pretty good gash wound on the side of his face, side of his head. His hip wouldn't look good. His foot's going the wrong direction. His hand is mangled. He's leaking. This guy's got hit so hard, there's no way.
We knew that at that point that it was a pretty bad wreck because it started making the news rounds. And by the time we got there, right up to the entrance, we could see the helicopter flying out. And we kind of knew, oh, that's Miles.
Truthfully, the first time they told me they were getting ready to transfer him to Lincoln, my first thought was thank you. I knew he was going someplace where they were specially trained to take care of the needs and the injuries that he had.
So other things, employee giving campaigns going on right now. It ends on September the 7th. If you guys have seen the chart in the cafeteria, you're doing a great job. I don't know what else to say, but we have very generous people, and this money goes to good use, and we're glad that we think it shows that you support our mission as an organization. I mentioned the open house we're doing for recruiting. We continue to do our ice cream socials every quarter on the night shift. It's a great way for the senior team to stay in contact with our staff on the night shift. We'll have a fall picnic on September the 25th. September 26th, we do our luncheon where we recognize our people with 5 years of service. Next forums are the end of October. And then November the 3rd is our epic upgrade.